Hello? Hello? Hello?
Yes, madam.
Yes, sir.
Yes, madam.
Sir, can we start now?
Okay.
Can we start now?
Madam, just a minute.
Okay, sir.
Amir sir, please start while you are waiting.
Yes, sir. Good afternoon to one and all. At the outset, I, Mr. Amir Kumar Mohanty, on behalf of Lalmohan Soy family, extend a hearty welcome to all the worthy invited dignitaries, the renowned and emerging doctors from Department of Oncology, Gynecology, and other research areas. First of all, I would deem it a great privilege to extend my hearty welcome to Dr. Lalmohan Soy, who belongs to Mayurbhanj, Odisha, and who qualified his MBBS degree from Hpv Medical College in 2001, and from 2003 to 2006 worked as the MD in radiation oncology, and also he is an assistant professor of medical oncology of Cuttaclk from 2014 till date. And of course, it's a great privilege to announce that he also worked as a faculty department of medical oncology at HCG Panda Curie Hospital from 2008 to 2009. Simultaneously, it's my great privilege to extend my heartfelt thanks to Dr. Smruti Pattnaik, ma'am, an emerging oncologist in the field of gynecology. She is from Hpv Cancer Hospital, Cuttaclk. Ma'am, I extend a warm welcome on behalf of Lalmohan Soy family.
Thank you, sir.
And it's my proud privilege to announce the name of Dr. Pranoti, ma'am, another emerging oncologist. Dr. Pranoti, ma'am, is working as an oncologist in Cancer Project of Cuttaclk District, spearheaded by Tata Trust. And of course, my heartfelt thanks and welcome to the esteemed principal of the institution, who is the prime source of inspiration among the galaxy of intellectuals. My juvenile welcome to all the students, parents, and staff of the school. Dear friends, the saying goes best, I am not afraid of storms, for I am learning how to sail my ship. The entire Lalmohan Parivar is in a state of ecstasy for organizing this webinar on cancer awareness, the most dreadful disease. Before the real show goes on, may I take the privilege of requesting the esteemed principal of the school to cast the welcome address.
Good afternoon, all the esteemed members present in the virtual platform.
Good
Esteemed
afternoon, sir.
doctors, oncologists, the supervisors, the teachers of both the school, Day.Lr Dav and Day.Lr Medical Public School, Cuttaclk, and my dear students. I, on behalf of the Day.Lr Dav administration, welcome each and every member to the webinar on National Cancer Awareness Day. I really grateful to welcome Dr. Lalmohan Soy, the Assistant Professor, Oncology, AHPGIC Cuttaclk. Sir, on behalf of all the members of both the DAV, I welcome on this platform. I honored you that you have given your valuable time for us. Simultaneously, I welcome Dr. Smruti Pattnaik,
Thank you,
the
sir.
oncologist at the Acharya Hariyar Cancer Hospital, Cuttaclk. Madam, thank you very much. You have given your consent and
Thank you so much.
ready to spare some time for the staff member and the students. And I also welcome Dr. Pranoti, Eminent oncologist. Madam, once again, I also welcome to you to this virtual platform on the webinar on National Cancer Awareness Day. The students and the teachers, those are present here. As you know, the cancer is now one of the dangerous disease, I can say, and where the research is going on worldwide, and the doctors also getting success. But the awareness how to protect from the cancer is highly required nowadays. Because as you know, the symptom and other things of the cancer patient, when it is coming to the patient, it becomes too late. And our lifestyle, our fooding habit and others, if can be checked as per the direction of the eminent doctors, those are present today, then at least we can protect ourselves from the deadly disease cancer. So for this reason, we have requested the doctors, and we must be very much thankful. They have given their consent and paying some valuable time to us. And we have to take some advice from them. And accordingly, if we're able to change our lifestyle as per the prescription or the direction of the doctors, then at least we can protect from this deadly disease that is cancer. Now in the 1.5 years, we all have fight against the unseen virus COVID-19. That is not totally ruled out from this country or the world. Still, it is a permanent thing, that is the cancer. So without late, may I request the organizer of this program, please proceed for the next, and we are eagerly waiting to listen from the eminent doctors on this National Cancer Awareness Day. Thank you. Thank you very much. Jai Hind.
Thank you, sir. Thank you very much for sharing your valuable ideas and even also giving a warm welcome to our invitees, the eminent doctors. So let's go for the real show now. May I request Dr. Pranoti ma'am, the eminent oncologist, to share her expertise and experience on this virtual platform so that all the members and even also the community will be aware of this. Ma'am, please, you are most welcome to this platform. It's over to Pranoti ma'am. So perhaps it is what we infer. Ma'am has some audio and video problem. So there will be a slight change in this agenda. May I request Dr. Smruti Pattnaik, ma'am, the eminent oncologist, to share her expertise and experience so that the entire staff members of both the schools, the students, parents, as well as the entire community as a whole will be getting benefit out of it. Ma'am, it's over to you, please.
Yes, sir, I'm sharing my screen. Is it visible? I started sharing. Is my screen visible?
Ma'am, it will come perhaps a bit late.
Hello, sir. Is my screen visible?
No, ma'am, it's not visible now. Yes, ma'am, it came now.
Yes, ma'am, it is coming now.
Hello, sir.
Yes, ma'am.
Now is it
Is-
visible?
Yes, ma'am, it is.
I'm unable to. Is it visible now? Hello?
Yes, ma'am, it's okay.
It's coming, ma'am. It's coming.
Hello.
Hello?
Madam, yes, coming. Yes, ma'am. Hello, ma'am. It's coming, ma'am.
Oh, God. Good afternoon to everyone. Today, myself, Dr. Smruti Pattnaik. Hello?
Yes,
Am I
ma'am.
audible? Hello?
Okay, yes, ma'am, you're audible.
Thank you, sir. Thank you, principal sir and organizer sir, for giving making such a good platform to increase awareness on cancer. And this is indirectly they are showing compassion towards the women community, a respect towards the women community, towards their life and how precious are their lives. And they are not only to be considered as housewives or as homemakers, but they have to survive. That's most important. And we are just taking their life for granted. And they are visiting us in the terminal stages. They have performed all their life duties. And when they come to us, they are no more in a stage of being revived, and they are unable to enjoy their life to fullest. And finally, they become the victim of cancer. We all have to work together to stop this and to prevent this and to make the society, the community, the women part, everyone should be aware of this gynecological malignancies, because mother is the most precious part of, in fact, mother is our source. So when we are supposed to be more concerned about our source, because once the source is going to die, then we are not going to prosper. So I have just tried to highlight on few points which will just bring some awareness about the burden of gynecological cancers and how we can really detect it and early in the early stages, and how we can effectively treat it, and finally we are able to cure it. Mm, so do you really know there are how many types of gynecological malignancies? Basically, we have a cervical cancer, an ovarian cancer, uterine cancer, vaginal, and a vulval cancer. Now, this loop sign which you are seeing, it is a symbol. It is a symbol of cancer awareness, which has been taken to increase the worldwide awareness regarding the cancer prevention program. Now, how can we make a woman or the society, the community more aware about this? Is by learning the symptoms, by listening to our bodies, and by acting with real knowledge. The burden of cancer I have shown in this pictorial pie chart. You can see uterine cancer and the cervical cancer. They are forming a major chunk of women cancer also. The awareness month of September, which has been chosen for gynecological cancer awareness. Now, primarily, we are focusing more on cervical cancer. It has come from eradication now to a step of elimination. Now, how can we make it possible? It's only possible by early detection, because if it is detected late, then things go out of our hands and we are unable to do anything, just giving support, palliation, and finally she dies. Subtle symptoms which we should all know, even her husband, even herself, she should also know what are the symptoms, like if she has bleeding, abnormal discharges, and postcoital bleeding, then unnecessary prolonged back pain, and she complains of fatigue. These are some prominent and imminent symptoms which we should not ignore and thinking them that, okay, it's all right, it happens, it will get cured. No. The small symptom is we become aware. That awareness word is so important. We are not aware. Once we become aware of the fact that these are just signs which our body is showing, symptoms which our body is showing, that this is the time you should be alert. You may be having cervical cancer. You may be having cervical cancer. It may not be in advanced stage, but still it is in a very subtle form, and you can treat it. Then it's an alarm for us that okay, nothing that we have cancer and we are going to die or something like that. At least I will go and get myself investigated, and I will know my stage, or I will know that I am having what type of cancer I have, whether it is cancer or something else. I need investigation because it's more in favor of cervical cancer. Now, what causes cervical cancer is again most important for us to know, like smoking and early age of intercourse, and excess unhealthy lifestyle, like which the women community are not aware of, and because of using unhygienic methods during their periods and menstruation, they should be aware of the hygienic techniques, which are hygienic methods which are available, and also smoking, etc., and multiple sexual partners. Then all this is possible by two steps: primary and a secondary prevention. Primary prevention is, nowadays everyone is aware that it is not only why is this cancer happening in our society. Besides the other causes, major factor for cervical cancer is the HPV. It is a virus. Once it starts infecting, it damages the cell and it causes cancer. So we know that it is a virus. We can fight it by vaccination. Then that why not we vaccinate our commune ladies, our girl child, and by making them aware about their health and hygiene, and so that they get prohibited from the causes of cancer. They do not, so that they stop on unhealthy, unhygienic practices, and they lead a healthy lifestyle. And secondary prevention is by screening and early detection, and then we can treat. The early detection is possible by if we start seeing the cervix at a very early stage of the symptoms. That is possible by a simple test which we do from the cervix. There is a uterus and there is a cervix. Cervix is the point where this cervical cancer occurs. From there, we can take a small smear-like thing. That smear will be taken by a brush, and it will be seen in a slide by the microscope by a pathologist. And the pathologist is going to tell that whether this is benign or going to be malignant, or is it in the precancerous stage, or is it something you need to be aware of. There's so many things about it. But first thing is we should do a pap smear when we have these symptoms. That is most important. Pap smear is nothing to be feared or get. You're not supposed to be scared about it at all. It's a very, very simple procedure, and it can save a woman's life. And this pap smear, we can go beyond the pap smear to visualizing the cervix by a camera that is called colposcopy, which we do, where we visualize the internal vagina, I mean the cervix, under a magnification, so that we can see the diseases are unhealthy and detect the unhealthy cervix, which the government and everyone is trying to do in the periphery level also by downstaging, that is detecting, simply inspecting the cervix. Colposcopy is of course a little bit higher by a camera, but you can simply inspect the cervix and know that what is the position of the cervix, whether it has already become cancerous, or can we prevent this lady from going into cancer by taking certain steps. Another one important screening test is the Hpv Dna, which we are doing nowadays. That is done in correlation with the pap smear report. Once your pap smear is abnormal and you are of a particular age, that is more than 30, then there are kits available for this detection of this HPV, a genetic, the gene genetic test which detects HPV 16 and HPV 18. And of course, there are nine types of variants of this virus, but these two are the most. 16 is the main culprit, which is causing cancer. There are special kits like COBAS and some other kits are available in certain specialized hospitals and private clinics. They are doing this test, which will help you hell of a thing from getting into progressive lesions. Once you have done this HPV, then you know that, okay, I'm infected with HPV, means I should get screened myself at least according to the screening protocol, so that I do not land up in cancer. And I'm early detected in a very early stage. So before going into this next thing is I want to make the community aware about the stages of cervical cancer. Cervical cancer is nothing that you have got cervical cancer. It's very like a scary thing. There's two stages. There is a pre-invasive stage and an invasive stage. In the pre-invasive stage, the thing is not, that means the pathology has not gone deep into the tissues. It is just superficial. In a layman's language, it is superficial. That means you can just scrub it out or brush it out, or you can burn it. There are so many technologies that you can just suck it out, then you are safe. That is described as L-seal or H-seal, a high-grade lesion and a low-grade lesion, but it is intraepithelial. That means it has not crossed the basement membrane. It is like boundary अच्छी गोटे cell थाए, cell गोटे tissue थाए, tissue रे cell थाए, बहुत गुड़ा cell गोटे boundaries ऊपर थाए. से boundary टाको basement membrane कहती. से basement membrane को ସେମାନେ ଯେତେବେଳେ ଫୁଟେଇ ନଥାନ୍ତି, ସେଟା ସେତେବେଳେ superficially ଥାଏ. Superficially ଥିଲେ ସେ କିଛି harm କରିବନି. harm କରିବା ପୂର୍ବରୁ ଯଦି ଆମେ ତାକୁ brush out କରିଦବା କି burn କରିଦବା କି coagulate କରିଦବା କି କାଟିଦବା, ତାହେଲେ ଆଗକୁ ସେ invasive ମାନେ ଭିତରକୁ ଫୁଟେଇବନି. Now once it goes inside, then we start staging, but still it is treatable. ତାର ଯଦି ଭିତରେ ବି ପଶିଛି ଆଉ ବହୁତ କମ ପଶିଛି, ତାକୁ ସେଥିପାଇଁ 1A1 ଆଉ 1A2 କୁହାଯାଇଛି. ଯେତେବେଳେ lesion ଟା ବାହାରକୁ କିଛି ବଡ ଗ୍ରୋଥ ଭଳିଆ ଦେଖାଯାଉନି, କିନ୍ତୁ ଭିତରକୁ ଅଳ୍ପ କିଛି ପଶିଛି, ତାକୁ ବି ଆମେ ଟ୍ରିଟ୍ କରିପାରିବୁ. ସେଟାକୁ ମାଇକ୍ରୋ ଇନଭାଜନ କୁହାଯାଉଛି. କିନ୍ତୁ lesion ଟା ମାନେ ସେଇ ଯୋଉ ଯେତେବେଳେ ବାହାରକୁ ଦେଖାଗଲା ତାକୁ ତାପରଠୁ stage 1B onward ସେଟା କୁହାଯାଉଛି 1B1, B2, B3. ତାପରେ ଯେତେବେଳେ ଟିକେ ପାଖାପାଖି ଯୋଉ ସବୁ organs अच्छी जमती हमारे mostly से affect करिवो परिस्रा नाली को that we all should know when we have urination गोटे माने बुढ़ी माउसी जिते परिस्रा प्रोब्लेम होची हुए तो ब्लीडिंग से लाजरे कहू नथिबो ना मोर ब्लीडिंग होची पुओ मते डॉक्टर पाखु ने कि कोन किंतु परिस्रा सिम्पटम जिते तार परिस्रा रही जीवो भाविबा कथा जे कैंसर होकी परिस्रा को बंद करिछि दैट इज अ वेरी इंपोर्टेंट सिम्पटम आ झाड़ा रे जिते किछि प्रॉब्लम आसिला माने झाड़ाटा झाड़ा रे बाहरी आसुची कि जानी पारे नाहंती सेही सब सिम्पटम्स हला कि किछि तमर गंठी भलिया जदि बाहरीला जेमती कहंती गुली टाइप रो बाहरीला जदि गोडर संधि भितरे कि जंघ संधि भितरे बड़ बड़ गुली बाहरीला एही सब सटल साइन जे ए डिजीज ता एडवांस रे अछि सेति पई स्टेजेस गुडा जानिबा वी शुड नो अबाउट द स्टेजेस एटा मो गोटे छोट पिक्चर देखे कि लेडी तार पैप स्मियर करिया को आसी तापई आमे गोटे छोट ब्रश नौछु देखो इट्स सच ए डेलिकेट एंड अ वेरी हार्मलेस ब्रश ताकू आमे स्पेकुलम देकी ता भितरे पसी कि तादर किछि लाळ अंश आनिकी एटा को आमे स्प्रेड करूछु गोटे काच स्लाइड ऊपर स्प्रेड करूछु ताकू कहउछे पैप स्मियर से तार अवेयरनेस एपर्यंत एते आसी गलानी आउरी आसीबा दरकार कल्पोस्कोपी आउ गोटे डिजाइन मेथड जद्वारा कि आपण देखुचंती एटी सर्विस तार डिफरेंट प्रकार रोग आमे टिके मैग्निफाइड वे रे देखि पारुछु आउ ताकू आमे सेही अनुसार सेही स्मियर भी नहीं परिबा सेही आमे ताकू बायोप्सी भी सेही गोटे छोट चंक ऑफ टिश्यू नहीं कि भी आमे बायोप्सी करि परिबा ताहले ताकू आगुरु आमे एडवांस स्टेज को जिबारु प्रिवेंट करि परिया तो मुझे तुमको आपण मानकु कहिली जे तार जेतेबेले प्री इनवाजिव स्टेज रे आमे ताकू जळेई परिबा ताकू थर्मोकोआगुलेशन यूज करके नहले एटा गोटे क्रायोफोब जोटा आमे कोल्ड मेथड रे टिके ठंडा ठंडा माने गैस के कूल हे गले सेटा क्रिस्टलाइज कर दबो और सेल ताकू नष्ट कर दबो सेठी ही डिजीज ता सरी वाला नहले ताकू आमे एमती काटी परिबा गोटे छोट प्लास्टिक लूप रे अंडर एनेस्थेसिया आमे गोटे छोट चंक एमती जस्ट ब्रश आउट करि परिबा एमती ताकू एग्जामिन करि परिबा तापरे एमती एनेस्थेसिया अंडर रे सेही पैथोलॉजिकल एरिया ताकू आमे एमती काटी की बाहर करि परिबा तापरे ताकू स्टडी करि की आमे ताकू पेशेंट को फॉलो अप करी कि फर्दर एडवांसमेंट को बंचई परिबा वैक्सीनेशन एबे बहुत रैम्पेंटली चली छी समस्त झियो माने भी अवेयर हेलेनी मां माने भी अवेयर हेलेनी various cervix gardasil these are all monovalent vaccines the bivalent quadrivalent vaccines market re asi galani and that will prevent cancer and it is 99% preventing HPV infection that I must tell and it is nothing to be feared that's what I want to tell cervical cancer is nothing to be feared but to be aware of by taking the appropriate steps at the appropriate time and month of January the year start को हमें cervical cancer awareness पलिया यहाँ है ची ଆଉ ଏବେ ନେସନ ୱାଇଡ୍ ଏଇ ପ୍ରୋଗ୍ରାମ ଟାକୁ କେମିତି ବଢା ହବ ସେଇଥିପାଇଁ WHO ଗୋଟେ ନ୍ୟାସନାଲ ସର୍ଭାଇକାଲ କ୍ୟାନ୍ସର କୋଆଲିସନ ପ୍ରୋଗ୍ରାମ ଷ୍ଟାର୍ଟ କରିଛି ଯୋଉଟା ସମସ୍ତଙ୍କ କୋଆଲିସନ ଯୋଉ କମ୍ୟୁନିଟି ଲେଭେଲ ଯେମିତି ଆପଣ ମାନେ ଆଜି ସ୍କୁଲରେ କଲେ it is so excellent it's so exciting and it's so encouraging and it's so of great help to the society which today DAV school is doing for the future health, being concerned about the future health of the girl child, I would say. The girls in your school should really be very, very thankful to your principal for arranging such kind of program and that will prevent you and all from going into cervical cancer and you all can go into the vaccination program after the age of 15. Now, what are the ways that the National Cervical Cancer Coalition Kohuchi? There are so many ways why we can really remove this and by becoming aware. That is the first, you have to raise awareness. That is the first step. That is which we are doing now. You have to raise the awareness that cervical cancer and HPV is related. And that is to be done in a good platform which will be beneficial. Like today's platform, it is in a school. Then there has to be a local chapter of this. then you have to be in contact with the leaders who are doing this kind of program. There has to be a proper friends joining into this program. There should be a good plan how to work on it, and about the investment and everything. And more should be done on the awareness month. That is the month of January. Then local newspaper plays important role. There are mommy groups, TV news, fundraisers, local brands, all these, even colleges, and everywhere we can just set up an alarm, a symbol, that loop symbol, and we can put it wherever we see adolescent girls together, even in slum areas, in schools, in orphanages, or in deprived places where women are there. Anywhere you can put it just to make them aware that this is curable and you can fight it by doing all this, by putting information booths, and by the help of online, Facebook, and all these things. So after the cervical cancer, I just gave you idea. Now I want to make the cervical cancer is of utmost importance in our country. Of course, ovarian cancer is also increasing. Now, ovarian cancer, we have to take action. There are no specific methods of screening ovarian cancer like that. There has been no protocol that once you screen, this is there and you treat it, then ovarian, it will not progress to ovarian cancer. As such, like in cervical cancer, ମୁଁ ଆପଣଙ୍କୁ କହିଲି ଗୋଟେ pre-invasive stage ଅଛି, ଆମେ screen କରି we get hold of that stage, it will not advance. But ovarian cancer is ସେମିତି କିଛି ନାହିଁ that you get know that now it is free. ଆମେ ଯଦି ଗୋଟେ community को screen କରିବା, starting କରିବା, ତାହେଲେ ଆମେ ovarian cancer ଧରି ପକେଇବା ଆଉ ତାଙ୍କୁ treat କରିବା, ସେମିତି କିଛି method ନାହିଁ. It's only awareness of the symptoms. ତାହେଲେ ସେମାନେ ଆସିକି ନିଜକୁ ନିଜେ ଟେଷ୍ଟ କରିବେ ଆଉ ଜାଣିବେ ଯେ ଆମେ କୋଉ ସ୍ଟେଜ ଅଫ ଡିଜିଜ ରେ. ଅଫକୋର୍ସ अर्ली स्टेज ରେ डिटेक्शन होई परिबो. सिम्पटम्स केमती ब्लोटिंग. हेलो 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 हेलो.
Yes, ma'am. You are audible, ma'am.
Yes, ma'am. You're audible.
Okay, now it is audible.
Yes, ma'am.
Yes, yes, ma'am.
You are audible,
Yes, ma'am. Absolutely audible.
Yeah, thank you. Now, please get now just see what are the symptoms which ଆମେ ଜାଣିବା କଥା. ଆମକୁ ovarian cancer ହେଇଛି କି ଗୋଟେ lady ର ଯଦି କହୁଛି ମୋ ପେଟ I am having bloating ଆଉ ମତେ discomfort ଲାଗୁଛି, and there is abdominal symptoms most probably like dyspepsia ଯୋଉଟା ଆମେ କହୁ ମୋର ପେଟଟା ସବୁବେଳେ full ଲାଗୁଛି, bloating full ଲାଗୁଛି, and we start ignoring it. And all that things, but it's actually they may be having cervical cancer. And ଯଦି ଏଇ ସବୁ symptoms ଗୋଟେ post menopausal ରହୁଛି. Most important is hello.
Yes, ma'am. You're audible.
ଏମିତି ଏଇ ସବୁ ଜିନିଷ ଯଦି ଗୋଟେ post menopausal lady ରେ ହଉଛି, ମାନେ more than 40 years, ଯଦି ସେ complain କରୁଛି ଯେ ମୋର ହଜମ ହଉନି, ମୋ ପେଟ ଫୁଲିକି ରହୁଛି ଆଉ ମୋ ତଳି ପେଟ ଦରଜ ହଉଛି, and ତାର family history ଅଛି ଯେ ଘରେ କାହାର କିଛି breast କି ovarian cancer ଏସବୁ କିଛି ହେଇଛି ଆଉ urination problem ବି ରହୁଛି, ଅଫକୋର୍ସ ସେଇଟା ଏତେ frequent ନୁହଁ, କିନ୍ତୁ abdominal symptoms ରହୁଛି, ଆମେ ignore କରିବା କଥା ନୁହଁ. We should take her and to a ଯଦି cancer न ଭାବ at least ଗୋଟେ gynecologist को भी ଦେଖେଇଲେ ସେ ତାକୁ refer କରିକି ଏଇଠି gynec oncologist ପାଖକୁ ନିଶ୍ଚିତ ଭାବରେ ଯଦି ସେ suspicion ବି କଲେ ଯେ ଏଇଟା ovarian cancer, ସେ ନିଶ୍ଚିତ ଗୋଟେ gynec onco setup କୁ ଆପଣଙ୍କୁ ପଠେଇବେ. ନା ମୁଁ ଯେମିତି କହିଲି ovarian cancer କୁ ଆମେ screen କରିପାରିବାନି. There is ଭଗବାନ ଏପର୍ଯ୍ୟନ୍ତ research ଚାଲିଛି ଆମେ କେମିତି screening କରିବା, how we will benefit the women ବହୁତ early stage ଯେତେବେଳେ ସେ invasive ହେଇନଥିବ, ଯେମିତି pap smear ଅଛି ସେମିତି ovarian cancer ପାଇଁ କିଛି pap smear ନାହିଁ. So ଆମେ ତାକୁ ଖାଲି detect କରିବା, that is important. That is done by a pelvic examination ଯୋଉଟା ଆମେ କହୁ, ଆଉ tumor markers ଯୋଉଟା ଆମ blood ରେ ଆମ ବଡିରେ କିଛି disease ହେଲେ ଭଗବାନ ଏମିତି କରିଛନ୍ତି ସବୁ ଜିନିଷ ଆମକୁ କାଟିକି ଦେଖିବା ଦରକାର ନାହିଁ. ବ୍ଲଡ୍ ଅଛି, ବ୍ଲଡ୍ କୁ ସାମ୍ପଲିଂ କରିଦିଅନ୍ତୁ, ଆପଣ ଜାଣିନେବେ ଯେ ଆପଣଙ୍କ ଡିଜିଜ ଅଛି ଓଭରିରେ. ବ୍ଲଡ୍ କୁ ସାମ୍ପଲ କରିଦିଅନ୍ତୁ, ଆପଣ ଜାଣିନେବେ ଡିଜିଜ ଅଛି ଷ୍ଟମକରେ. ब्लड को सैंपल करंतु आपण जानिबे आपण को डिजीज अछि ब्रेस्ट रे all this is possible by blood markers. Blood markers basically beta chi ovarian cancer type. One is CA125 और गोटे CEA. And this CA125 that post menopausal ladies को ପାଇଁ basically बेसी important. सेमानकर जो CA125, this CA is a very good thing and it's a great help to us. जदि बढ़ी छि this CA cancer marker तमें भाविबे जे किछि गोटे गड़बड़ अछि एटा अन्य कंडीशन रे भी बढ़े बट जब भी बढ़ी के अछि गोटे 45 इयर्स लेडी एज रे लेडी ऊपर then definitely you think that I have to be properly investigated. Our biopsy is just to detect the pathology. The methods to diagnose ovarian cancer, the imaging जो डॉक्टर पाखु आपण गायनोकोलॉजिस्ट पाखु जिबे से निश्चय आपको इमेजिंग एडवाइस करेंगे सस्पिशन हेले से कहबे आपण गोटे अल्ट्रासाउंड कर दियंतु आ मते डाउट लगुची जे किछि प्रॉब्लम अछि फर्स्ट स्टेप अल्ट्रासाउंड विषय हमें समस्त जानी आ कैंसर में स्पेसिफिकली डॉपलर अल्ट्रासाउंड गोटे हम जानबा कथा डॉपलर अल्ट्रासाउंड इज ऑफ यूजफुल इन ओवेरियन कैंसर ता पर स्टेप से देखि कि तांको जदी गायनोकोलॉजिस्ट को सस्पिशन लागिला से oncologist ताको पठेबे oncologist ताको स्टडी करिकि भाबिबे मु ए पेशेंट को सीटी स्कैन करिवि कि एमआरआई करिवि मो सस्पिशन से देयर इज स्कोरिंग अछि मु सेटा आपनको कहि पारुनी किंतु सेटा इंटरनेशनल वे रे स्कोरिंग अछि स्पेसिफिकली फॉर ओवेरियन कैंसर ताको आयोटा स्कोरिंग कहउछन्ती जोथरे कि से माने मैलिग्नेंट और बिनाइन डिजीज को एक्चुअली स्कोरिंग करी अल्ट्रासाउंड रे दबा कथा तापरे जो भी मास देखिले सिंपली ताको जस्ट राइटिंग इट क्लिनिकल कोरिलेशन सेटा नो तांको पार्ट भी 90% इमेजिंग लोकंकर से माने स्कोरिंग ता लेखि कि ताको more in favor of benign or malignant empty करके देले it will be of use to gynec oncologist and also to the patient अଯଥା मनी वे समस्त को हमें सीटी एमआरआई काहे की करबा सपोज जो अल्ट्रासाउंड मिशन रे हमें कम्युनिटी लेवल जो स्टार्ट करबा अल्ट्रासाउंड करबा जदी ताहले बहुत गुड केसेस डिटेक्ट मैलिग्नेंट केसेस भी हमें प्रॉपर्ली करले डिटेक्ट करि पारिबा तापरे हमें नहेले वी शुड गो फॉर द extra investigations. Those are very costly, which is not of help in community level. Next is about the staging. Staging हमें जानिबा जेंति हमें तार गोटे प्री इन्वाजिव स्टेज थिला आर एमपी एबे इवॉल्व होउची किंतु सिनेरियो को आसीने एक्चुअली एमपी किछि बाहर आसीने सबले इन्वाजिव स्टेज पर ही स्टेज 1 2 3 4 चार स्टेज फर्स्ट स्टेज रे इट विल बी कंफाइंड टू द ओवरी माने अंडाकोश भीतर रहिला आ स्टेज 2 रे से पेल्विस को गला अंडाकोश रु टिके बाहर की ता पाखा की बुलिला स्टेज 3 रे आउरी पेट पाखापाखी पाकस्थली पाखापाखी जेति भी सब अच्छी सेफ्टी गला स्टेज 4 रे सेठू नहीं कि दूर ऑर्गन्स को ब्लड थ्रू रु गला ब्लड थ्रू रु से तापरे लंग्स को बोन्स को गला that is the advanced stage. A stage रे ovarian cancer देखि आसुचंती that is the matter of grief that is really to be very very it a बहुत matter of concern अबगता है cervical cancer को हमें प्राय देखु छु पेशेंट के ब्लीडिंग हेले पळे आसुचंती वाइट डिस्चार्ज हेले पळे आसुचंती 40 इयर्स above किंतु ovarian cancer प्राय तो आसिला बेले को स्टेज 3 रे आसुचंती जोतरे कि किछि भी हेल्प हे पारुनी होउची we are trying to remove as much as possible but survival का से अनुसार एते होउनी बेटर जदी समान स्टेज 1 रे हम पाखरे आसी पारंते आउरी अर्ली आसी पारंते तो बेटर होता नेक्स्ट है कि अवेयरनेस अबाउट तापरे मो नेक्स्ट भी एटा ओवेरियन कैंसर ऑन द होल किछ आईडिया हैला जदी नेक्स्ट आई वांट टू गो टू एंडोमेट्रियल कैंसर तापरे आमे जोटा हमर थळी जोटा हमर फुल्ल घर हम कहू ता भीतर रो कैंसर जोटा हुए सेटा लेडीज मानकर एबे बढ़ुची सर्वाइकल कैंसर पर एबे एंडोमेट्रियल कैंसर बढ़ुची काहे कि बिकॉज ऑफ हमर स्ट्रेसफुल लाइफस्टाइल रे ओबेसिटी बढ़ुची ओबेसिटी इज अ वेरी इंपोर्टेंट कॉज ऑफ एंडोमेट्रियल इट्स अ प्रिवेंटेबल कॉज तबे जदी जो वेट को कंट्रोल रे रखिबो बॉडी रे एक्स्ट्रा हार्मोन्स प्रोड्यूस होबनी bad hormones जोटा हमें estrogen कहूँ estrogen, if estrogen is extra it will cause endometrial cancer in our body. झील मानक आमको polycystic ovaries अच्छी, polycystic ovaries अबिका अच्छी, PCOS, later on you may land in endometrial cancer. यदि बहुत दिन polycystic ovaries रहिला तम बॉडी रे हार्मोन एस्ट्रोजन बढ़ी की रहिला ताकू तुमको endometrial cancer होई पारे. So obesity you can control it. It's by exercise, by dieting, and by yoga. All these things you can control your hormones. Hormones come from the brain. That is which is controlled by the pituitary, which you can control it by yoga, by doing exercises, by your diet. Lifestyle changes can reduce obesity. Other risk factors अच्छी जोटा hereditary factors. सेटा ovarian रे भी अच्छी है, किंतु सेटा तो हमें प्रिवेंटेबल आम हाथ रे नाही, बट एटा आम हाथ रे अच्छी. ओबेसिटी को हमें कंट्रोल रे रखि परिबा. और स्पेशली जो लेडीज मानकर डायबिटीज और हाइपरटेंशन अच्छी, they should be very conscious that तांको endometrial जल्दी bleeding हेला हमें सांगे संग जांगी डॉक्टर को कंसल्ट करिया, गायनेकोलॉजिस्ट फर्स्ट है ना, गायनी ऑन्कोलॉजिस्ट. The symptoms. What are the symptoms of endometrial cancer? हमें केमते जानिया जे हमरो भितरु एटा हेछि, एटा हमरो ब्लीडिंग, abnormal bleeding होछि, तळे पेट सब बेले बथा होछि, and pain after sex, and there is pain in between or after menopause. Menopause is a risky age. After that, anything you will have testes, माने पूरा genital tract रो कुछ भी कोई to be cancer होई पारे. 80 किंतु हमें lucky again. Just like cervical cancer, we are again lucky in endometrial cancer. There is God is really भगवान रोग माने मनुष्य देइचंती, मनुष्य देहरे रोग भी देइचंती, रोग देला परे भय भी देइचंती, पुणी टिके कहिचंती तमे तमे जदी बाट को आसीबो मु तम पे आउ गोटे बाट रखिछि. ता पूर्वरु जदी ताहार भाग्य टिके भलो अछि बंचिबारु तार गोटे ए स्टेज रे जदी धरा पड़ी गला, देन शी ए खसिला मृत्यु मोहरे. सेतिपई बिफोर endometrial, prior to endometrial cancer, there is a pre-invasive stage जोटा हमें को that is endometrial hyperplasia. सेई स्टेज रे बहुत जन लेडीज आसुचंती हमको ब्लीडिंग होची. That's very good. हमको ब्लीडिंग होची, एक्स्ट्रा ब्लीडिंग होची, and I want to get evaluated. तापरे गोटे गायनेकोलॉजिस्ट सस्पेशन करछि अरे ब्लीडिंग होची, प्रोटोकॉल अनुसार हमें कोन करिया. ब्लीडिंग हला जेंती फर्स्ट भी हमें गोटे तार गोटे ऑफिस हिस्टेरोस्कोपी और ऑफिस बायोप्सी सेटा कहउचंती, जोटा आउटडोर रे आउट पेशेंट रे करिबा कथा. सेटा करी कि ना हमें आगो बायोप्सी ता को स्टडी करनउछु, एटा हाइपरप्लेसिया अछि. ताको कोरिलेट करिया पई दुटा दिनस हमें करूछु. अल्ट्रासाउंड एडवाइस करूछु, अल्ट्रासाउंड करी के आनंतु. अल्ट्रासाउंड रे किछि प्रॉब्लम देखा गले हमें तांको एडवाइस करूछु तमे हमें कैविटी देखिबा को चाहूछु, हमें हिस्टेरोस्कोपी करिबु. हिस्टेरोस्कोपी रे अपन गोटे पिक्चर मु देखैछि, एटा हमें यूट्रस भीतर हिस्टेरोस्कोपी करिकि हाइपरप्लासिया को देखुछु. एटा माने यूट्रस भीतर सब नॉर्मली प्लेन रहबा कथा, किंतु एटा बेसी मांस सेठी जोटा हमरो मेंस्ट्रुअल शेडिंग हुए, से शेडिंग परे भी एडा सब बॉडी की रहिछि, माने एडा एब्नॉर्मल, एडा अल्ट्रासाउंड रे फुल्ली की रहिछि गर्भगृहटा. There are options for treatment of this endometrial hyperplasia. That is such with a very good thing. आमे जदि endometrial hyperplasia पाउछु, अच्छा आमे काहे ताकू कहिबा आगु को देखिबा कोन होउची, जदि तार एज होई गलानी आमे ताकू ट्रीटमेंट ऑप्शंस होउची. तमे would you like to remove your uterus if you have completed your family, or you want to get एंती बारंबार आसिकी अल्ट्रासाउंड करियो, बायोप्सी करिवो ना, तमे तमे यूट्रस काट देबा को चाहता. तने कहना मैडम फैमिली कंप्लीटेड अछि, एज मोर देन 40, आमे आउ यूट्रस रखिबोनी. तो सेटा इंटेलिजेंट माने डिसीजन नउ चंती. और जो माने यंग एज में फैमिली कंप्लीट करी नाहंती और से माने चाहू चंती एते यंग एज रे हमें कंसीव भी करिनो, देन आमे तांको सेठी हार्मोनल मैनेजमेंट रो ऑप्शन दोछु. हम हार्मोन्स खांतु and you repeatedly come for ultrasound, and once you conceive and you get completed your family, after that we will, if this persists, we will remove your uterus. So एटा गोटे प्राय बहुत प्राय endometrial cancer रे बहुत पूर्व स्टेज रे तन करी ब्लीडिंग हेले एमते किछि वरी डबार नै जे आबे किछि करिबार नाही बोली. Then once you get into endometrial cancer, एटा देखंतु एटा यूट्रस रे से ब्लू कलर रे देखैछि कैंसर ता रे भितरे अछि जे स्टेज 1 तापरे टिके आसी गला भितरे पेनिट्रेट करी आसीछि स्टेज 2 रे तापरे स्टेज आसी कि सर्विक्स को इन्वॉल्व करछि से तळे स्टेज 3 रे से ऑलमोस्ट दी पोटे आसी गलाडी बाहर को जोटा हमर गुड़ा इन्वॉल्व हे गलाडी सेठी सब स्टेज 4 बी बेली को से बाहर को 4A रे लोकली और 4B रे बाहर को लिवर पर्यंत मारी आसलानी दैट इज एबे किंतु कैंसर मिक्स्ड स्टेजेस रे आसीछंती एंडोमेट्रियल कैंसर बहुत गुडा स्टेज 1 2 रे भी आसीछंती बिकॉज पीपल माने बहुत अवेयर हे गलेनी समझते दैट इट इज पॉसिबल तापरे नेक्स्ट स्लाइड तो मु आपन माने को
Madam, excuse me, ma'am. Excuse me, ma'am. Are you showing some slides, ma'am?
Yes, sir.
But it's not visible. It's not coming on screen.
None of them. Till now, whatever I have shown, is it coming?
No, ma'am. I think it's not coming.
Nothing is visible.
No. Not even your videography also.
Okay. Okay, now I have started. Is it visible? Hello?
No, ma'am. It's not visible.
Okay. Whatever मुझे तो कहली से भी किसी देखा गला नहीं?
No, no, no.
Also got a slide. Okay, sir, I'll just try to show you little more. Just a second, I'll do it. Just a second, I'll try it again. Is it like it?
No, ma'am. It's coming because you are now trying to show through the WhatsApp, so it takes time.
Okay, okay. I have opened it now. Just to
Yes, it's coming now. Yes.
Now I want to know from which slide you haven't seen, which are the slides. Cervical cancer is all slides dekha gala ki?
Yes, yes, ma'am.
Yes, madam.
Yes, ma'am. Now it is.
Ebe dekha hoch prak.
Ebe ठीक ठाक अछि. Yes, ma'am.
तो देखा जाए ना चला सही स्लाइड को हम देखे देबे आखा ना. Ovarian cancer. एटा endometrial hyperplasia ऊपर मु कॉल चली जोटा एटा विजिबल के लगे.
No, ma'am, it was not. I mean,
Now
continue.
madam.
Now it is visible, I think.
Yes, yes.
Yeah.
Yes.
एटा मु endometrial hyperplasia ऊपर कॉल चली एमटी जस्ट बट हमारा ऑप्शंस ऑफ ट्रीटमेंट अच्छी एज को नहीं कि हमें हिस्टेक्टोमी की हार्मोनल मैनेजमेंट करूछु सो दैट दे डोंट लैंड इन कैंसर ताको अल्ट्रासाउंड इमेजिंग करूछु अल्ट्रासाउंड इमेजिंग करे हमें ताको एडवाइस करूछु आपण कोन करिबा कथा हिस्टेरोस्कोपी करिबा कथा एंड आफ्टर हिस्टेरोस्कोपी हमें किछि इन्फ्रेंस नेला परे बायोप्सी परे हमें ताको फर्दर फॉलो और ये रखुछु एटा मु स्टेजिंग कहतली स्टेजिंग फर्स्ट से ब्लू चित्र रे सेटा यूट्रस को कंफाइंड अछि तापरे इट इज गोइंग टू टिके बियॉन्ड जाउची तापरे भीतर को एब्डोमेन कैविटी को तापरे बाहर को किंतु बहुत थोड़ा पेशेंट स्टेज 1 2 रे भी आसी छथि तापरे दिस इज ऑल चैप्टर कैंसर दी तीनटा कैंसर भीतर कहली बट टू अदर टू कैंसर्स आई जस्ट वांट टू स्पीक अबाउट देम vulval and vaginal cancer so many they present with vulval cancer mostly माने vulva जोटा सेटा माने हम बाहर organ जोटा सेटा प्रेजेंट करे मोस्टली बाय इचिंग इज अ वेरी इंपोर्टेंट कंप्लेंट ताकू हमें अभी अर्ली स्टेज रे एमपी स्मीयर करी देखि परिबा आ रिसर्च करी परिबा तापरे हमें एडवाइस करी परिबा वजाइना भी सेमती अर्ली एडवांस स्टेजेस में भी माने सेमती ब्लीडिंग करके पेन प्रेजेंट करे, स्कैन पेन, पेल्विक पेन, बैक एक ए सब सिम्पटम्स ताको डिटेक्शन करिया पई सेमती स्मीयर हेरिका करके हम जानि परिबा, बट बेसी इंसिडेंट तांकर बहुत कम. Vagina is really 1 to 2% or something like that, and vulva is also less than 10% incidence. So more focus सेटिफाई cervical cancer ऊपर बेसी थिला, तापर endometrial और ovarian cancer ऊपर. Finally ये सबू तक cancer is treatable by surgery, chemotherapy, by targeted therapy जो तो हम एबे कहती, और radiation therapy and immunotherapy. Thank you so much for your patientful hearing. And if any queries, you can please ask. And all this is possible by the combined effort of our department, HPGIC, our HOD, Dr. Gita Parija, and Associate Professor, Dr. Janmanjay Mahapatra, sir, Dr. Bhagyalakshmi, Madam, Dr. M.R. Mahapatra, and Dr. A.K. Padhi, sir. And it's a privilege on the behalf of Institute also to speak on this topic at level of school, which is really impressive. The girls will be so much benefited from this. Thank you, sir.
Thank you, ma'am. Thank you very much.
I can any queries or any questions? If anyone wants to clarify anything, can ask.
So, dear esteemed members, it's a questionnaire session from Dr. Smruti Pattnaik, who is ready to answer your queries. If you have any queries and all, you can put forward.
Okay, no questions.
Okay.
Nice.
So, thank you, ma'am. Thank you once again for spotlighting various gynecology-related challenges and different health abnormalities that lead to cancer. Thank you, ma'am. Thank you once again for making us aware, the entire team of both the schools as well as the community as a whole. Thank you once again from our DAV Parivar and SAV Medical Public School. Thank you, ma'am, once again.
I would like to leave, sir. I have a work in the hospital, so I will leave the webinar. Thank you.
Okay, ma'am. Okay. It's a pleasure to listen to you. Thank you, ma'am. Now may I request our esteemed Dr. Smruti Pattnaik, may I request now Dr. Lalmohan Soy, sir now, eminent oncologist, to share his expertise and experience and address to this August gathering on this virtual platform. Sir, it is over to you. Thank you, sir. Thank you very much for being with us. Sir, would you please unmute yourself? No, sir, we are not able to listen to you.
Thank you, sir. Good afternoon, everyone. Respected regional officers, sir. Assistant Regional Officer Madam, Cluster Heads, Subject in charge, Sri Vipin Kumar Sahu sir, Accessor, Sri Sai Siva sir, Master Trainers, and my dear competitors. On behalf of entire DAV Parivar, I welcome all the members to this capacity building.
Lalmohan sir, good afternoon, sir. Sir, your screen is visible, but you are not yet audible, sir. Hello, Amish sir.
Sir.
I think Lalmohan sir is not audible to us.
No, sir, not yet.
I have also given a call
Sir,
to
it is
him.
audible now?
Yes, sir, it is audible now, sir. It's audible.
Yes, sir, it's audible, sir. Okay. Sir.
Sir, my screen presentation is visible, sir.
Sir, you have started sharing the screen. It will come.
Yes, sir. Yes,
Yes,
sir, it
sir.
has come.
Sir. Good afternoon, sir. Thank you, all you, sir, for your wonderful introduction. Respected principal, sir, teachers of Day.Lr Dav school, and dear students and parents of the Day.Lr public school and audiences of today's webinar. And I also thank Mr. Naik, sir, and Dav family and organizer for inviting me for today's webinar on National Cancer Awareness Program Day. So,
Thank you, sir.
this is the, as you know, November is a month of Cancer Awareness Day, and 7th November is a National Cancer Awareness Day, and it is also a month of Lung Cancer Awareness Day, and National Cancer Awareness Day of Pancreatic Cancer also comes in this month. And also we celebrate it as a National Hospice and Palliative Care Month in this month of November. So today I will speak about the cancer myths or facts of the cancer. What is the burden of cancer? What are the symptoms and carcinogenic factors? Followed by what is the treatment option? And how can we prevent the cancer? So, Dr. Smruti has spoken about the malignancy, cancer of gynecological malignancy, how we'll diagnose or how we'll screen the disease or how we can treat or prevent it. So, what are the myths? My screen is visible, sir. What are
Yes,
the
sir.
myths of cancer? Cancer is not a death sentence. Whether eating sugar can make cancer worse? No. Any artificial sweeteners will cause cancer or no? And cancer is not a contagious at all. A cancer surgery or biopsy will not spread the cancer, or it may spread very low, spread capacity is very low. Cell phones will not cause any cancer. If someone in your family has a cancer and it is not, you are not likely to get cancer, there are only 5 to 10% of familial or hereditary cancer which runs in family. If no one in family has had cancer, does not mean that you are risk-free of cancer. Antiperspirant or deodorant will not cause any breast cancer. Hair dye will not increase the risk of cancer. So if we see the survival data, in stage 1, the survival is very high. It is more than 80 to 90%. That early stage cancer are highly curable if detected in early stage. So this is the 5-year survival data of breast cancer. Again, stage 0 survival is more than 90%. In stage 1, it is more than 80%. Nearly 90% of patients will survive for 5 years. So what we understand as cancer? It is defined as an abnormal mass of tissue that grows with and in a uncoordinated manner, and that persists in the same excessive manner after the cessation of stimuli. That cancer will grow in a uncoordinated manner, and it will replace the adjacent normal tissue. So division is an uncontrolled cell division occurs, and there will be a formation of a lump or tumor or a large number of abnormal white cells in the blood, and mutation will happen, that is changes to how the cell is viewed by the immune system, and cancer will spread to the adjacent organ, that is ability to move within the body and survive in another part. So let's go to the introduction part. Cancer is one of the most common disease in the developed world, and it is the second leading cause of death globally and also in India. And 5 most frequent cancers in India are breast cancer, cervical cancer, oral cavity cancer, lung cancer, and colorectal cancer. These are the 5 most frequent cancers in India. So, use of tobacco products are the single most preventable cause of death worldwide. More common in India die from cervical cancer than in any other country. When breast cancer is the most common cancer in India and accounts for about quarter of all cancers in women in India. So, what is the cancer burden? In Globocon data 2020, global cancer burden is 19.3 million cases, out of which 10 million cancer deaths are seen. In India, 2018 WHO data, 1.16 million new cancer cases are seen, out of which 1 in 10 Indians developed cancer during their lifetime and 1 in 15 died of the diseases. This is a global cancer data. In 2020, lung cancer is the highest, followed by, in a male, lung cancer is highest, followed by prostate cancer, colorectal cancer, stomach cancer, and liver cancer. In female, breast cancer is the highest. Breast cancer is the highest, followed by colorectal, lung cancer, and cervical cancer. In India, this is the 2018 data. If you see both sexes in all age groups, breast cancer is the highest, followed by lip and oral cavity cancer, cervical cancer, lung cancer, and stomach cancer. This is, if we see the male, lip and oral cavity cancer is the highest, followed by lung cancer and stomach and colorectal cancer in male. And in female, breast cancer is the highest, followed by cervical cancer, ovarian cancer, and ovarian cancer. So total number of new cases are 11,15,000 cases, and number of deaths are 7,84,821 cases, and number of prevalent cases in 5 years during that year 2018, that is patients alive at that time are 22,58,288 cases are seen. So there is a high death cases are observed in year 2018. So this is the incidence rate of cancer in 2016 in different states and union territories of India. So highest number of cases are seen in Kerala and Mizoram, followed by Haryana, Delhi, Goa, Assam, so we can see the highest number of cases are in Kerala and Mizoram. In Orissa, it is 83.6 per lakh populations cases of cancer are seen in 2018. So how do we differentiate malignant from benign tumors? If we see the mode of growth, benign tumor is has a capsule, but in malignant tumor there is no capsule. It has an expansile growth in benign tumor. In malignant tumor, it is an expansile growth, along with it has an infiltrative capacity to the nervous structures. So this is the graphical picture. If it's benign tumors will stay adjacent to the normal tissue like this, and in malignant cases, this way malignant tumor will stay with the normal tissue in the aggressive mode. So normal versus abnormal cell growth. division of normal cell is precisely controlled. New cells are only formed for growth or replace the dead ones. Cancerous cells divide repeatedly out of control even though they are not needed. They crowd out other normal cells and function abnormally. They can also destroy the functioning of major organs. These are the different types of cancer. This is lung cancer, first one. Second one is colon and rectal cancer. And this is the prostate cancer. Third one. This is a picture of breast cancer. This is a picture of endometrial cancer. Second one. And third one is this is a picture of cervical cancer. It is situated in the lower part of uterus. This is a melanoma skin cancer which originates from the melanin pigment of skin. This is tongue cancer. This is leukoplakic cancer in the vocal mucosa cavity. This is a pre-malignant condition like looking. This is also ulcerative lesion in the vocal mucosa. So these are the all advanced malignant cancers in head and neck region, mainly vocal mucosa and neck. This is very advanced malignancy. So this is the picture of prominent peoples of world and India who have treated with cancer and cured out of the cancer. So what are the risk factors for cancer development? These are the factors like hereditary factors, immunological factors, chemical, physical, viral, or bacterial or lifestyle factors are playing role for cancer production. What are the hereditary factors we see? These are the genes isolated for several classic familial cancer syndrome like RB1 gene in retinoblastoma, APC gene for familial polyposis, human non-polyposis colon cancer, BRCA1 and 2 for breast cancer, P53 gene is a tumor suppressor gene for many cancers. Hereditary cancer is seen in 5 to 10% of cases. So immunity, if patient is HIV or AIDS, there is a high risk of development of cancer. If patient is having immunosuppression like heart disease, lung disease, or diabetes, or any transplant, they have a higher risk for cancer development. Viruses also will cause cancer, like hepatitis B virus will lead to liver cancer, and human T-cell leukemia virus will cause leukemia or lymphoma. Epstein-Barr virus will cause Burkitt's lymphoma or nasopharyngeal carcinoma. Human papilloma viruses will cause cervical cancer and oropharyngeal cancer and anogenital cancer in humans. So bacteria also will lead to or increase the risk of cancer like H. pylori will cause carcinoma of stomach. This is the slide showing estimated cancer burden from infection with different viruses and bacteria. If you see the developed country attributable cancer with these agents, it is 3,89,000 cases. In a total number of cases out of 5,16,000 cases. In developing country, it is 15,27,000 of attributable cancer with these viral infections. So there are many number of cases are seen in 2002 in different developing countries with different viruses and bacterial infections. So these are the list of chemicals which will lead to the cancer, like alcohol, asbestos, wood dust, rubber, plastic, dye, tar, bitumen, aflatoxin, alkylating agents, and tobacco. These will all lead to the risk the cancer or increase the cancer risk. Physical causes, this is ultraviolet like radiation or subtle industrial sources or radiation sources from radon or cancer treatment also will lead to cancer. And lifestyle changes will lead to cancer. If we grow older, cancer risk will increase, and occupation has a definite role, like farmers, fishermen will develop lip cancer, plumbers, those who are working for furniture making from wood dust, they will develop nasal cancers, and those working for tobacco workers or waiters, they will develop lung cancer for their occupation. If we see ethnicity, American Cancer Society has shown that African American will develop more cancer as compared to the Hispanics and Caucasian groups or Asian Americans or American native peoples, and socio-economic deprivation has an increased risk of cancer, and the patient has very poorer outcome. So if we see the smoking, tobacco uses causes cancer throughout the body. It will from GI system, mouth, throat cancer, stomach cancer, colon or rectal cancer, and hepatobiliary cancers, liver cancers are seen, pancreatic cancer. Also respiratory system, it will affect like laryngeal cancer, lung cancer, bronchus or tracheal cancer, their kidney and renal pelvis cancer or genitourinary cancer, cervical cancer, urinary bladder cancers, and also bone marrow tumors like blood cancers, acute myeloid leukemia are the cancers seen with the tobacco use. So there are many cancers are listed by use of tobacco. So what are the forms of tobacco in India? It is in FCB tobacco, in Andhra Pradesh or Karnataka, BD tobacco, cigar, cheroot, hookah, chewing or snuff, nattu, burali, pika, etc. These are the forms of tobacco taken in different part of our different part of the nation. So why tobacco is so much injurious to health? Tobacco smoke include, these are the chemicals contains in tobacco. So acetone, ammonia, arsenic, butane, cadmium, carbon monoxide, DDT, hydrogen cyanide, methanol, naphthalene, toluene, vinyl chloride, which are also found in these like paint toner, floor cleaner or ant poison. All these poisonous chemicals are present in the tobacco smoke. So what are the lifetime risks with tobacco? If a person having 10 cigarettes per week, there is increase in absolute lifetime risk. In case of male, it is 2%. In case of man, it is 2%. In case of female, it is 1.5%. If a woman is taking 1 bottle of wine per week, the risk is 1.5%. And in men, it is 1%. If we combine, it is risk is again increased to more than 2 to 3%. So these are the risk factors we have already discussed: age, sex, heredity, occupation, diet and nutrition, or geographical factors. So let's see what is the pathogenesis, how cancer happens. Cancer, there are 3 phases like initiation, promotion, or progression. There are 3 phases. Cancer is initiated by mutagens like physical, chemical, biological agents, or radiation, and cell is changed, genetically altered cell, which there is a gene mutation or chromosomal aberration is occurred, and there is a mutation in the proto-oncogene and tumor suppressor genes, which will produce more tumorigenic cells and some non-tumorigenic cells. The tumorigenic clones are also produced. These cells are increased in number, and they will progress and invert to the nearby structures. So in a pathogenesis, in a cell, if DNA damage in normal cell, there is successful DNA repair, so that it will not develop into the malignant, which continuously occur inside our normal body. That is, it is a balanced programmed cell cycle inside the body. But sometimes by by acquired DNA damage or by inherited mutations, the cells will lead to malignant neoplasm. So what are the symptoms? We can see by caution, that is change in bowel or bladder habit. If we see a sore throat that does not heal, use unusual bleeding or discharges from any of the orifices of the body, is thickening or lump in breast or any part of our body. If patient is having indigestion, difficulty in swallowing, if patient is having obvious change in weight or mole, if we have having nagging cough or hoarseness for long duration, these are the all warning signs. If somebody of us will get these signs, we have to consult the nearby physician. So cancer stage. Already we know there is 4 stages of cancer. Mom has already told. We follow the TNM staging. This is tumor size and lymphatic node metastasis, and distant side metastasis is stage 4. So if it is stage 1 is tumor size less than, in lung cancer it is less than 3 centimeters. Stage 2 is 3 to 5 centimeters, or stage 3 is more than 5 to 7 centimeters, and stage 4 is if it metastasizes to different sites or other parts of the lung. In almost cancer have 4 stages of the 4 stages in development or progression or in treatment. So how will diagnose and treat the cancer? Cancer is diagnosed by clinically and radiologically, and followed by histopathological examination. The tumor tissue or site is scrap cytology or biopsy is taken from the tumor site by the surgeons, and its histopathological examination is carried out, followed by molecular test or genetic tests are done, and then treatment is done by oncologist. So, and also there are other support staffs like psychiatric consultation is also required, nursing support staff, and other audit systems are done, and AGI are also working for diagnosis and treatment part. So this is the picture showing surgery. This is the picture of radiation machine, where radiotherapy done with the tumor site. This is the daycare system. Chemotherapy is given to the patient. So patients in the treatment, there is a lot of familial burden, social and economical burden patient will suffer. So what treatment will give in the midway of a traffic? So they need social, financial and psychological support for their treatment. So prevention is better than treatment. So can cancer can be prevented? Yes, we can prevent the cancer by avoiding some carcinogens, and by leading the better lifestyle we can avoid the cancer. So prevention, how can we do? By not using tobacco or stop taking alcohol, doing regular exercise or physical activity, maintain a healthy weight, and reduce the estrogen exposure by eating fruits and vegetables and healthy diet, and protect yourself from sun, and avoid risky behavior like not sharing the needles, doing regular checkup or medical care, and if breastfeeding is done, breast cancer risk is decreased, and also by vaccination like in hepatitis B vaccine and HPV vaccines, as already discussed by Smruti madam. So screening is done for early detection in the breast. This is a picture of breast cancer screening of mammography. This is the picture showing digital rectal examination of the prostate cancer. So cancer screening and prevention screening tests for common types of cancer are in the breast. It is mammogram. Breast cancer screening is done in a group of more than 50 years of age in a woman. And cervical screening is done with a PAP test or Hpv test, as already discussed. Hpv testing is done in a age group more than 25 years age up to 65-year age group of women, and it is done once in a 2 to 3 years time. And colon cancer, the fecal occult blood test, colonoscopy, sigmoidoscopy, digital examination done in a age group of patients 50 years or at the age of 50, at least once into 2 to 3 years. And prostate cancer digital rectal examination is done patients having more than age of 40 years age. So these are the cancer days to remember. November is the National Cancer Day, 7 November, and 4th February World Cancer Day, and 5th February International Childhood Cancer Awareness Day, and October is the Breast Cancer Awareness Day. These are the awareness ribbons. The breast cancer is pink, all the cancer is a lavender color, and childhood cancer is a gold color. So cancer earlier was death warrant, but now can be managed very well if detected early. Patient can lead a good quality of life. So awareness and early detection are key for successful outcome from cancer. Thank you, sir. Hello.
Yes,
Thank you,
sir.
sir. Thank you,
Hello.
sir.
Thank you. Yes, sir.
Thank you, sir. For
Thank
your
you, sir.
patience sharing.
Thank you so much, sir.
So, thank you, sir. Dr. Lalmohan Soy was talking to us for a long time, the eminent oncologist, and he has already shared his experience, his expertise, and even spotlighted on the prevailing dreadful scenario of cancer, and what are the different factors responsible for such a dreadful disease, and even also what are the different effects of the disease on human life, and even he has also suggested how to combat the tragedy. Thank you, sir. Thank you so much once again. Now we would move to now Dr. Pranoti ma'am, to whom we have been wishing since a long time, and because of some net issues, perhaps she could not talk to us from the beginning. She could not deliver her session. So may I request Dr. Pranoti ma'am to address the August gathering, please.
Hello, am I audible?
Yes,
ma'am.
ma'am.
You're audible.
Hello, good afternoon. Sorry for earlier. I had some technical issues. I'll just share my screen.
It's okay, ma'am.
Can you see my screen?
Yes, yes, ma'am.
So, on the occasion of National Cancer Awareness Day, so I'm going to present on oral cancer awareness and the importance of tobacco cessation counseling when it comes to head and neck cancer. So, these are the contents of my presentation. Like I'll be covering about introduction, risk factors of oral cancer, signs and symptoms, guidelines for oral cancer screening, some common tobacco-related conditions, then tobacco cessation counseling, and finally the conclusion. So we all know, we are aware of the tobacco products which are available in the market, which is so like everyone uses these products. So it may be in the form of smokeless tobacco, which we see in these packets, or in the form of smoking forms which are in the form of cigarettes, BDs, or also a regular, which we call as this sweet pan. All these are tobacco products which are harmful for the body. So a normal cigarette smoke contains around 7,357 chemicals. So out of that, 70 are known cancer-causing chemicals. So we all know, most of us know that nicotine is the main cause or main content of the of a cigarette, which causes the addiction. So nicotine is known to cause increase in blood pressure and increase in blood glucose and heart rate also, apart from the addiction part of the cigarette. So apart from there are many carcinogens like N-nitrosamine, benzene, aromatic amine. So all these are few chemicals which are actually present in many household chemicals which we use, like maybe Baygon, like the insect killers, the uh, the usual in the batteries. So many harmful chemicals are actually present in one cigarette itself, which many people are using every day. So this is the normal incidence of cancer. So if we see the presence of lip oral cavity or oral cancers are quite high. And when we see in India, among males, it seems to be the most common cancer in males in India. So it is very important for early detection. So if we detect a cancer early, it can be cured early. So we emphasize a lot on early detection of cancer. So if you see, if it's diagnosed early, 81% there's more chances of survival. And when you compare it to diagnosing late, there's very less chances of survival. So it's around 26%. So common risk factors for oral cancer is most commonly is tobacco, alcohol, and a lot of mouthwashes with high alcohol content can also cause oral cancer. Apart from that, physical irritants, like if a person has a sharp tooth and continues to keep on biting on one area of the mouth, that can also cause cancer. Also, apart from that, if there's any nutrition deficiency, any prolonged sun exposure, hormonal changes, and viruses also can cause oral cancer. So people who are aged more than 40 years are increased risk for developing cancer. So usually 18 to 39 years of age. So that's the time when most of the people, they start using tobacco. So the risk increases because of that. Also there will be chronic alcohol consumption, and there's more chances of oral HPV infection or human papillomavirus infection also during that time, which causes increased risk of the people. So highest risk is when the person is aged more than 65 years and if there's a history of other cancers. So these are the risk factors of oral cancer, like how I mentioned: use of tobacco products, alcohol consumption, any sexually transmitted infection from human papillomavirus, a weakened immune system, if a person has weakened immune system, and sharp teeth. So these are the signs and symptoms which are present in oral cancer. So many people, some people are very anxious when they have a small maybe problem inside the mouth, and if they have a habit of chewing tobacco or using tobacco, they have a lot of they become anxious that they might get cancer. But actually these are the signs and symptoms which shows that a person might have cancer. So a person might have difficulty in taking tongue out of the mouth, changing voice. There might be changing voice, like it can be a nasal tone. Then there's excessive saliva and difficulty in chewing and speaking, difficulty in swallowing. If there's a cancer or tumor in the neck, then swelling or lump in the neck if the lymph nodes are involved. And also inside the mouth, if there's a white or red patch in the mouth, wounds that don't heal for more than a month. So if there's an ulcer inside the mouth for more than a month, it has to be examined. And extreme sensation of eating spicy food. Many people who continuously use tobacco, they are not able to chew, they are not able to eat spicy food. So that is one of the symptoms of oral cancer or pre-cancer. And there's also difficulty in pulling out the tongue and ulcer on tongue or any other part. So like how I already mentioned, the sore in the mouth, there might be persistent mouth pain and white or red patch, sore throat or feeling inside the throat, and difficulty in swallowing, chewing, and difficulty in moving the jaw or tongue. So usually for detecting oral cancer, this is how an examination of the mouth should be done. So we check all around the mouth, like top, the upper lip part, then the side of the cheek, left and right side of the cheek, the lower lip, the hard palate, which is the roof of the mouth, and the tonsil, which is behind the tongue and below the tongue, and the sides of the tongue. So there are many conditions which might seem alarming for a person who is not aware of these conditions. So I'll just show few conditions which are normal in a human body. So this is linea alba, which is a white line which is present on the cheek, which is because of chronic biting on the like just the regular biting action. So there's this white line which is present on the cheek. Sometimes because of melanin pigmentation, like India, most of the Indians, we are dark complexion, so we have more melanin pigmentation in our skin, and so it shows inside our mouth also. So it is nothing to be alarmed about. This is something which is very normal in most of the Indian people. So another thing is called as podiasis granule, which shows seen as yellowish spots. This is also very normal component or normal feature seen in many people. This is called geographic thumb. So this is just patches which is seen in the mouth, in the tongue. So it keeps changing the location, and it's very normal, and it hardly has any symptoms. Very seldom, very less people have any burning sensation when they have this problem, but actually it is quite normal. This is lingual varicosities, which is present on the lower part of the or the under the tongue. So this is a normal feature of the mouth. So before cancer, I'll just go around. I'll talk about a little bit about pre-cancer conditions. So these pre-cancer conditions, they are more likely to turn into cancer. So a lot of tobacco users, or maybe if they have alcohol use also concurrently, if they use alcohol with tobacco, they have more chances of developing these conditions. So how I mentioned, in oral cancer, there are white patches or red patches. So this is one example of pre-cancer, which is seen as a white patch, which is known as leukoplakia. So this is something which is very frequently seen in tobacco users. It doesn't have much of malignant transformation or increased chances of turning into cancer, but still, if there's more, if it's a large area or large patch, it's better to be diagnosed, or it's better to get biopsy done for this. So this is another condition called lichen planus, which is seen mostly in women. So this has many people complain of burning sensation when they have this problem, and this also has a chance of turning into cancer, but the chances are very less. This is a very common condition seen in Indian population, because many people here are beaten nut chewers, or maybe they are gutka chewers. So when they use increased gutka, beaten nut, or maybe pan masala, they have this condition known as oral submucous fibrosis. This condition is seen like where the person is not able to open the mouth and the cheeks become hard. So many of us maybe might have come across this condition where a person who continuously keeps chewing gutka, they might have this condition where they're not able to open the mouth, and they might be not able to eat anything spicy at all. They're not able to tolerate spicy food at all. So this is a very common condition, and this is a very difficult condition to treat actually, because the mouth opening is like how we can see in this picture, only 2 fingers are going in this picture. Usually 4 fingers should go inside a normal mouth. So if it's open wide, 3 to 4 fingers should go inside. But a person who is suffering from this condition, only 2 fingers can go inside the mouth. This is another condition called Cessation. So these are all precancerous conditions, and this is called tobacco pouch keratosis, which is very common in smokeless tobacco users. So they keep it inside the mouth in the part next to the teeth. So they have this white patch. This is seen mostly in smokers. So it's seen on the roof of the mouth. So this is oral cancer, how we see, what we see in these pictures. So it looks like a growth. So if you touch it, it seems very firm to hard. And if you can see, a very proliferative growth. It's like a very growth kind of appearance is giving. So this one is giving more like a cauliflower growth kind of appearance, and this we can see it's like an ulcer on the tongue. So if you go to examine this case, we'll be able to appreciate that it's very firm to hard to touch. So these are all pictures of oral cancer. So as I have already mentioned that tobacco is one of the main causes of oral cancer. So it's very important to control the tobacco habit itself. So if we are able to control the tobacco habit, the disease progress is stopped, and the and sufficiently affects the disease progress. So tobacco cessation is very important. So if we see, India comes second in the tobacco producer, second largest tobacco producing country. So like how we produce, we consume also. We are also one of the largest consumers of tobacco. So we are at increased risk of oral cancer. So if we see here in this is a global adult tobacco survey. It shows that 47.9% of males and 20.3% of females and 34.6% of the adults use tobacco in one or other form in India. So if we see, smokeless tobacco users are a lot in our country compared to smoking and both smoking and smokeless. So these are known risk factors from smoking. So cancers are main things: head and neck cancer, it causes lung cancer, leukemia, stomach, kidney. So it affects mostly all of the organs of the body where it causes cancer. Apart from that, there's increased chances of stroke, blindness, gum infection, aortic rupture, heart disease, hardening of the arteries, reduced fertility, hip fracture, a lot of effects on the body. Apart from these also chances of psoriasis, hearing loss, cataract, wrinkling, tooth decay, and osteoporosis. So how do people develop this dependence to tobacco? So as I've already mentioned, it is because of nicotine. So nicotine causes the addiction towards tobacco. So nicotine releases a neurotransmitter called dopamine. Dopamine increases the pleasure level in a person. So whenever a person smokes or uses tobacco in smokeless form, it gives a pleasurable or high feeling to the person. So the person always wants to go back to the same feeling of pleasure. So the person tends to get addicted to tobacco in this manner. So it's important to know where we can get help for tobacco cessation. So a lot of tobacco users, I'm sure there are a lot of tobacco users in and around all of us. So how we can help those people? So there are tobacco cessation clinics all over India, and there's a national quitline service also. So this quitline number can be used if anyone is interested to quit their habit. They can always call this number and get the assistance to quit the habit. So we know that in schools there are a lot of the adolescents or the children or the students, they start their habit at at a very young age in school itself, they start their tobacco habits because they always have this urge to start something new, or because of peer pressure, they want to try out and they start using tobacco, and then consequently they start getting addicted to these products. So how we can help these students? So I believe there are a lot of teachers today in this session. So first, if you want to help a student, we can first ask about the habit, if they have any habit as such. Then we can advise them on how to on the tobacco, ill effects of tobacco and how it is harming the body. Then we can assess if the person who we are talking to are willing to quit the habit. And then if they are willing to quit the habit, we can assist them maybe by guiding them to a tobacco, maybe to a practitioner who can provide some pharmacotherapy like nicotine gums can be given, or maybe any other medicines can be given. So we can guide them to someone who can give those kind of pharmacotherapies, and then we can arrange for a follow-up of that person. So patients who are unwilling to quit tobacco, we can use the 5 R's concept. 5 R's concept is relevance, risk, reward, roadblocks, and repetition. So we always, when we are counseling a patient, we always supposed to tailor the advice as per how they how it is relevant to that person. So if a student per se is having a tobacco habit, uh, we can just say that if we start smoking now, you might become like your father. Maybe if his father is a smoker, just notice how your father is, his health is uh, degrading. You should not smoke. So make it relevant to their condition, and then outline the risk of using tobacco. Then reward them. So if uh, just tell them how, the rewards of quitting. So how it will benefit them in short. And the roadblocks. So there are a lot of roadblocks while a person is on a quick journey. So maybe they'll have withdrawal symptoms, or maybe inform them that they will feel very anxious. They'll be feeling, there'll be less of sleep. So all these things should be mentioned. So these are kind of roadblocks for a person to, it should be mentioned to the person who is unwilling to quit tobacco. And repeat messages. We should repeat continuously. The same message should be reiterated. It should be mentioned to them so that it's imprinted in their head. So barriers of tobacco cessation, I would say most of it is because of lack of knowledge of ill effects of tobacco. Cigarettes are very addictive, as we all know. So it's very difficult to quit, and lack of knowledge is one of the reasons why people don't quit. Apart from that, there's a lot of ignorance and negligence also. Even though people know about it, they they don't want to leave it because they are living a pleasurable life with the use of tobacco. So they don't see the harmful effects at that time, and they are negligent or ignorant about the ill effects, and they always say that we'll see later. Now we are fine, अभी के लिए तो हम लोग ठीक है, बाद में देखेंगे. So it's always later. So these are kind of nicotine replacement therapy which is available: nicotine gum, patches, microtabs, lozenges, inhalers, and nasal spray. So in India right now, nicotine gums and nicotine patches are mostly used for control of the tobacco cessation. So in summary, I would say, even though pharmacotherapy or nicotine replacement therapy is important, it's important aid to help in tobacco cessation. But counseling is more important. Counseling is the first thing, or the most important thing which should be emphasized on, because without counseling, none of it will work. None of the other therapies will work because the person needs to make up their mind first and then need to try other therapies. So counseling should be given a lot of importance. Thank you.
Thank you, ma'am. Thank you very much for addressing this, the August gathering of this virtual platform. And of course, the awareness that you created will be definitely effective in the days to come. And your focus on oral cancer and even the different harmful effects of it, and even the concept of 5R will certainly make the common people aware about it. So on behalf of our DAV family and DAV Medical Public School, we extend our hearty thanks to you for joining us and for sparing your valuable time. Thank you once again. Now it's over to Mrs. Nivedita ma'am to propose vote of thanks. That is the last part of the show we have come to. So may I request Mrs. Nivedita ma'am, Physical Biology, to propose vote of thanks. It's over to ma'am, please.
Sir, I am audible.
Yes, yes. Audible.
So I am and I will. That is the slogan of National Cancer Awareness Day 2021. That means we should kick cancer before cancer kicks us. Good afternoon, everyone. In the present day scenario, when we rarely find time to talk to doctors and unknowingly we enter into the world of health hazards. There is a saying, eat healthy and stay healthy. And now, in 21st century, the need of physical consequences is physical exercise or yoga. Today, we are really fortunate to have eminent doctors what say are their valuable suggestions and advices how to keep ourselves away from the fatal disease like cancer by following a balanced diet and healthy habits. From the core of my heart, I express my thanks to Dr. Pranoti ma'am, Dr. Smruti Pattnaik ma'am, and Dr. Lalmohan Soy sir. They are the eminent oncologists. They have given their valuable suggestions, gracious presence in this virtual platform. Despite of their busy schedule. My sincere thanks to our revered principal sir for his constant guidance and timely suggestion to hold such programs what situation demands. Last but not the least, a special round of thanks to all the esteemed staff members of LR Public School and SCV Medical DAV Public School to spare their valuable time to make this program successful. Thanks all. Jai Hind, Jai Bharat.
Thank you, ma'am. Thank you very much. It's over to Sarveshwar sir. May I request our technical expert, Mr. Sarveshwar Mr. sir, to wind up the session. Sir, please, with due permission of everybody.